As you know, we have been working very hard to streamline every facet of the testing process across the province. I know the time it takes to get results is still not as fast as we would like it to be, and work continues to shorten this. In addition, we have heard concerns from parents and guardians about their inability to access their children's results as quickly as possible and to get a written record of negative results. Effective today, all parents and guardians in Alberta can now access COVID-19 results for their children through My Health Records. Once a child is tested, parents will be able to log in and see their children's results as soon as they are available, anytime, day or night. This information is accessible to parents and guardians of any child under the age of 18. As an added feature, parents will also be able to print their children's COVID-19 test results and show them to others if needed. Sign up is free, and all that's required is government-issued ID and your personal health number. Information is available at alberta.ca/myhealthrecords. I encourage all parents to sign up. I recognize there is still more to do, and we will continue to look for ways to reduce testing wait times and meet the demand. Turning to today's update, there are currently 64 people in hospital with COVID-19, including 12 in intensive care. We identified 173 new cases of COVID-19 yesterday, and the provincial lab has completed more than 14,000 tests in the last 24 hours. Currently, Alberta has almost 1,600 active cases. There have been 2 additional deaths since our last update. I have also been informed of an additional death today at the outbreak at the Foothills Medical Centre, which will be included in tomorrow's online numbers. As always, it is essential that we never forget that these deaths are more than numbers. They are people who were loved and whose absence creates a tremendous hole for family and friends, which is true for all those who have died recently, no matter what the cause. Health officials continue to work hard to manage the outbreak of COVID-19 at the Foothills Medical Centre. To date, a total of 35 patients and 29 healthcare workers have tested positive, along with 3 visitors. Contact tracing continues, and the situation is being closely monitored. Enhanced screening measures among patients and unit healthcare workers have been implemented, and the hospital has increased infection prevention and control measures. The investigation into this outbreak and the sources of exposure is still underway. Turning to schools, as of today, 28 schools have come off of alert status with no transmission, and affected students and staff are back in the classroom. There are active alerts or outbreaks in 133 schools, which is about 5% of all schools in the province. There are currently 257 active cases at these schools. There are 52 schools with an outbreak, including 7 which are currently on the watch list, with 5 or more cases. I want to remind everyone that a school outbreak is called with just 2 cases in a school and does not mean the school is unsafe. In fact, only 11 of these schools have had any likely in-school transmission, with most leading to only 1 case. It has already been 1 month since students first started going back to school. More than 101,000 tests have been completed for school-aged Albertans since September 1st, with a positivity rate of less than 1%. I want to thank all the parents, teachers, students, and school staff for their hard work and dedication during these last 4 weeks. You were a big part of why we have kept cases under control and have so far prevented widespread transmission within classes and schools. I know Halloween is a favorite day for many, and I know many parents are already planning their children's costumes and activities. I have no plans to suggest that Alberta cancel Halloween this year. My own children would never forgive me. In many ways, Halloween is actually safer to celebrate than other holidays. Unlike Thanksgiving, for example, where families traditionally gather inside to enjoy dinner together, most of Halloween's activities take place outdoors and largely within one family. However, we do need to make it as safe as possible to celebrate this year. That is why we have created a page with tips and advice on how you and your family can enjoy a Halloween that is still fun, and scary, but for the right reasons. You'll find it at alberta.ca/Halloween. We've also created posters you can print and put in your window or on your door to let trick-or-treaters know if you're handing out candy this year or not. If you choose to hand out treats, or if you have children trick-or-treating, please review the tip sheet in detail. However, let me summarize a few key points right now. First, please avoid hosting group get-togethers or Halloween parties. Instead, trick-or-treating should be done within your own cohort or family and staying within your community, and avoiding contact with common touch points like doorbells or hand railings. Dressing up and trick-or-treating is the best part of Halloween for many children, and this can be done safely by choosing costumes that allow children to wear a non-medical mask. Like elsewhere in public, try to minimize your contact with others and maintain 2-meter physical distancing whenever possible. If you're handing out candy, wear a mask. And if the weather is warm enough, consider handing out treats outside on your driveway or front lawn. Try to get creative and have fun with the ways to minimize the risk of exposure that comes when giving out candy, like the candy slide I mentioned earlier this week. And please use prepackaged candy, not homemade treats. As always, the safest way to ensure we have a safe Thanksgiving, Halloween, and school year is to limit community transmission. I wrote an op-ed earlier this week stating that the future is in our hands, and this remains true. We are all in this together. If we all do our part and stay vigilant, we can keep each other safe and limit the need for any future restrictions that could impact other elements of our health. I believe last week we tested over 24,000 school-aged children, and the positivity rate for that school-aged population in April, when we saw our peak, we were sitting at around a peak positivity rate of about 8 or 9% of all people, of all those children who were tested. About 8 or 9% in April were coming back with a positive. And right now, in the last week, we're sitting at below 1%. So again, we are finding, that trend that you report of increased number of cases comes along with a massive increase in the number of children who are getting tested. And that's likely, again, due to the fact that we have other respiratory viruses circulating in our community. And so the vast majority of children who go for a test, greater than 99%, in fact, do not have COVID-19. So both of those facts together, again, indicate that we have not seen a massive increase in cases. In fact, again, we did see a slight decline in the first few weeks, with, again, a little bit of a rise in this most recent week, but nothing to suggest that school is driving those cases.